Good afternoon, everyone. Thank you for joining us. We're just allowing time for our many guests to join the webinar, and we'll get started in about a minute. Okay, well, it's just gone 1 o'clock. I know that there's a lot of people very keen to hear what's going to be discussed today, so we're going to make a start. Good afternoon. My name is Liz Deepers, and I'll be hosting this webinar on behalf of ARACY today. Thank you for joining us. We're meeting today on the unceded sovereign lands of Aboriginal people. We acknowledge the traditional custodians and their enduring connection to its lands, water and skies. I pay my respects to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples. In solidarity, ARACY supports the Uluru Statement from the Heart and the need for truth-telling about the history and impact of colonisation. We treasure the rich and diverse cultures and customs of First Nations people, the valued knowledge holders, leaders and partners in creating the conditions for all children to thrive. I'm coming to you today from unceded Dharawal country, and please feel free to acknowledge the country you're joining from today in the chat. During the webinar, your mics and cameras will remain off for the session. You will be able to add questions for our panellists via the Q&A in the control panel at the top of the Teams webinar window. Please post questions at any time. The webinar is being recorded, and this recording will be made available on the ARACY website and YouTube channel. Recognising how critical the early years are for children's development and continued success over their lifetime, the Australian Government has developed an early years strategy that articulates how the Australian Government will prioritise and support child-centred policy and development and target investment in the early years, supports and services over the next 10 years. The strategy aims to create a more integrated, coordinated approach to Commonwealth policy and investment in early childhood across Australian government portfolios and to better deliver outcomes for children aged 0 to 5 and their families. ARACY is proud to have played a key role in shaping this strategy, with both our founder, Professor Fiona Stanley, and Penny Dakin, the former CEO of ARACY, both serving on the expert advisory panel. The NEST, Australia's framework for child-centred wellbeing, developed by ARACY, has also informed the development of this long-term vision. Extending on our passion for the strategy and the opportunities it brings to support children and families to thrive, we're excited to be joined today by representatives of the Department of Social Services and the Department of Education to gain further insights into the development of this pivotal initiative and hear about the next steps. So it's my pleasure to introduce you to today. Sorry, just bringing them on the screen. Introduce to you today Jacqueline Hrast, Branch Manager, Child and Parenting Wellbeing Branch, Department of Social Services, and Helen McInerney, Acting Branch Manager, Early Learning and First Nations Priority Branch from the Department of Education. Jacqueline Hrast entered the public service in 2006 and worked at both state and federal level across several portfolios. She was promoted into the Senior Executive Service in 2021. Jack holds deep experience in disability policy, including Commonwealth state policy, negotiations and secondments as a ministerial advisor and Operation COVID Shield to improve the operational approach to the COVID-19 vaccine rollout for people with disability. In her current role, Jack leads program and policy areas to improve outcomes for children and families, including the Commonwealth Government's early years strategy. Jack holds a Juris Doctor with commendation, specialising in public law from the Australian National University, and a Bachelor of Arts, First Class Honours, Australian Literature from the University of Sydney. Helen McInerney joined the Australian Public Service in 2011 and has broad experience across the spectrum of educational policy. Helen is currently acting spectrum of education policy through early childhood education and care and schools and vocational education and training. Helen is currently acting Assistant Secretary of the Early Learning and First Nations Priorities Branch in the Department of Education. In her regular role, she leads the team responsible for early learning and development policy, including supporting the development and implementation of the early years strategy, undertaking projects in collaboration with state and territory governments, and supporting Australia's participation in early childhood education and care related fora in the Organisation for Economic Cooperation and Development, the OECD. Helen holds a Masters of Evaluation from the University of Melbourne and a Bachelor of Arts and Bachelor of Laws from Monash University. Welcome, Jack and Helen. Thanks for joining us today. Sorry about the little tech glitch where I forgot to bring Jack on screen. But I know that everyone here is really keen to hear from both of you. So without further ado, the stage is yours.
Thank you, Liz, and thank you to ARACY for this opportunity to speak to people. We're really happy to see how many people have registered for this webinar and how many people are interested in the early years strategy. I'd like to join in Liz's acknowledgement of country. Today I join you from the lands of the Ngunnawal people, and traditional custodians of the land on which I join you from today. So our presentation today is going to take you through some of the detail around how we developed the strategy and some of the evidence that underpins it. And then Helen will take you through some of the elements of the strategy, and then we'll talk a little bit about next steps. So as I'm sure most of you know, the early years strategy focuses on that 0 to 5, starting from conception. I don't think I need to talk about the importance of the early years to this group. I think you're probably all true believers. But one of the things that we did do under the strategy was do a very plain English evidence summary of what we know about the early years and the evidence and research that really underpin the strategy. So I do commend that to you, and we'll share a link to that in the chat in case you haven't seen that yet. So as Liz explained, the early years strategy really is the Australian government's commitment to create a new integrated, holistic and whole of Commonwealth approach to the early years. It was launched on the 7th of May by our ministers, Minister Rishworth and Minister Ali. And it outlines a 10-year framework to shape how the government prioritises young children's wellbeing and signposts area for future government action. It's the most recent and comprehensive Commonwealth articulation of what an optimum early years system looks like in order to best support Australia's children and their families. The strategy was released on the Department of Social Services website, along with the strategy snapshot, which is a handy 2-pager, and also the evidence summary I mentioned, as well as a whole of Commonwealth progress update on the measures to date to support children and family in the early years. So I just wanted to take you through a little bit about how we got here, and particularly through our consultation roadmap. So the Department of Social Services, supported by the Department of Education, led a very comprehensive consultation process over the last 18 months across 2 phases to inform the development of the strategy. And the consultations highlighted real-life priorities and issues facing families in the early years. It was important for both of our ministers to really progress a family-centred approach to consultation, and they prioritised hearing directly from parents and children alongside the voices and perspectives of sector representatives and services. So the first phase of national consultation included the National Early Years Summit, which some of you may have attended. We had over 100 attendees at that, followed by our online survey, which received over 2,000 responses. And that survey responses really drove the development of the strategy's 8 outcomes and 4 priority focus areas that Helen will take you through shortly. We had a submission process in that early stage where we received over 350 written responses. We also did a series of expert roundtables and community consultations across Australia, and we ran consultations with 115 children aged 3 to 5, led by the Front Project, and I'll talk a little bit about that later. The second phase of consultation was on the draft strategy itself. That came out in December 2023, and the activities around that was a targeted consultation with 230 parents and caregivers to give us a broad spectrum of how people were receiving the strategy at that point, and an online survey to which we received over 400 responses. So during the roundtables we had from February to July 2023, they really provided an opportunity to consult with stakeholders representing particular sectors, groups, topics or demographics important in the early years. So we had roundtables on health, research, early education and care, social services, disability, literacy and language. We also had specific groups on Aboriginal and Torres Strait Islander families, culturally and linguistically diverse families, LGBTIQA+ families, and regional, rural and remote Australians. As you can see from some of the quotes on the slides, parents told us that they what they wanted for their children and how they wanted to be supported both individually and at a community level. Some of the other interesting themes raised through this period was the importance of education for parents and families, particularly with a focus on health and development, and establishing and building communities and informal networks around families. Parents and families shared the way that pressures limit their opportunity to spend quality time with their children, including financial stresses, balancing work and other commitments with their role as parents and caregivers. There was also quite a strong theme of the culturally entrenched gender roles that accompany parenting, the high burden of care and primary parenting role placed on mothers, which can potentially exclude or lessen the role of fathers in children's lives or really limit understanding of how modern families are structured. The children's consultations was something very new for the Department of Social Services and, dare I say, government more broadly. They really focused on 3 to 5-year-olds, and we met with them in early childhood and care settings. And its primary objective was to identify things that matter most to children in their lives, including the people, places and activities. And we asked them what would make today a better day. So to assist in children's capturing their insights, a range of methods were used by our partner, the Front Project. Children were asked to use paint, pencils, crayons or other mediums to create an artwork that portrays the person or people that are most important to you, which you can see on the screen there. We also asked them to create a landscape with loose materials. So they were prompted to create a 3-dimensional construction piece or project that represented a place or an environment that was really important to them. And then there was some semi-structured discussion around their happiest moment and memory. So children were asked to describe their happiest day, including what they did, who they did it with, and where they were at the time. The results across all 3 of these methodologies really revealed 4 key themes for what children felt was most important in this age. They were the connections and relationships with their families, both immediate and extended, and their friends and educators. That children were deeply attuned to the environments and the settings around them. That imagination and creativity were central to their lives, both inspiring and shaping their experiences, and that opportunities to engage in physical activity were really important to children. We did a consultation report summary that's also available on the DSS website if you'd like to deep dive into some of these details more. The second stage of consultations, as I mentioned, was on the draft strategy. So we consulted with the community between December and January of this year with a focus on individual parents and carers, and then also supported by an online survey. Overall, the majority of people thought the outcomes and the priority focus areas were comprehensive and relevant, but a couple of key issues came forward that led to us refining some things further ahead of the final strategy. So there was very legitimate concerns about the length and complexity of the language in the draft strategy. There was a request to include a stronger explicit focus on mental health, especially the parent and the child, and the role of the sector, the early education and care sector, in supporting this. We also heard from many parents who wanted greater emphasis on the role that they play, and they felt that some parts of the strategy was putting too greater emphasis on early education and care. So to be perfectly honest, we probably got a 50-50 split on those who wanted more recognition for the role parents play, and then those who wanted more detail on the role ECEC plays. So it really was a task for us to kind of balance both of those requests. And there was also finally a request to better describe child development and the protective factors required to support children to thrive. And that was one of the key drivers why we also published an evidence summary alongside the strategy, so there was more room for us to go into more detail on that. So in response to those, we did shorten the strategy significantly, broke it into those two documents, and made the language much more simpler and easier to understand, less government speak. We also included more information about how the priorities will be delivered, and balance that focus between improving early education and care and empowering parents to raise their children and be one of their first teachers. So in terms of governance, Liz briefly touched on this at the intro, but the strategy was guided by an advisory panel external to government, consisting of experts. As she mentioned, both Penny Dakin and Fiona Stanley were part of that panel. It also included people like the National Children's Commissioner, Catherine Little, the CEO of SNAKE, and Professor Sharon Goldfield, to name a few. Those names are also published on the DSS website. It's also overseen by a Band 3, a Deputy Secretary level committee across the Commonwealth. So I'll now hand over to Helen to go through elements of the strategy.
Thanks so much, Jack, and lovely to be here with you all today. I'm delighted to be joining you from the lands of the Wurundjeri people of the Kulin Nation. And as Jack said, so I'm just going to go through some of the actual details of the strategy itself. So to start with, the strategy outlines a vision, 5 principles, 8 outcomes, and 4 priority focus areas, which articulate where the government's going to direct its efforts to achieve the strategy's vision and outcomes. Each of these 4 components is essential for the strategy to be implemented successfully. Together, they ensure that the government will work towards reducing program funding silos across departments, better integrating and coordinating functions and activities across the Commonwealth, and better delivering outcomes for children aged 0 to 5 and their families. So the vision is for all children in Australia to thrive in their early years, and that children have the opportunity to reach their full potential when nurtured by empowered and connected families who are supported by strong communities. This vision was carefully crafted through the extensive consultation that Jack has just mentioned, with great attention paid to every word used. The vision places children at the centre of the strategy, and therefore at the centre of the decision-making when it comes to policies that will affect and impact children and their families. It also complements and uses similar language to the National Aboriginal and Torres Strait Islander Early Childhood Strategy that was released in December 2021. So the strategy has developed 5 key principles which will guide how the government will work to support children and families in their early years. In particular, they will guide how the government will deliver the strategy through the action plans and outcomes framework, which Jack will touch on at the end of this presentation. The strategy outlines examples of what the government will do under each of the principles, so I'll just touch on a few of them. In relation to child and family-centred, it includes focusing on ensuring the voices of children and their families are included in the policies and decisions that affect them. For strengths-based, it recognises the abilities, knowledge and capacities of young children and their families, as well as the strength that relationships between children and their families provide. Respect for families and communities highlights the importance of respecting and valuing the role of parents, caregivers, families, kin, educators, communities, language and culture play for children. It's quite broad. Equitable, inclusive and respectful of diversity reinforces the importance of valuing all forms of diversity, including in relation to gender, culture, language, place and disability. And finally, evidence-informed discusses the importance of building and continually drawing on the latest available data, evidence and insights to design, develop and review supports and services for children and families. The priority focus areas is where the government will direct its efforts to achieve the strategy's vision and outcomes. We identified these priorities based on feedback from parents, caregivers, families, kin, community members, and the early years workforce through our consultations. So the 4 priority focus areas are valuing the early years, empowering parents, caregivers, and families, support and work with communities, and strengthening accountability and coordination. These areas are strongly supported by the evidence summary, which discusses the importance of early childhood development. So within the strategy itself, there's more detailed information about how each of these areas will be delivered, but I'll give you a very high-level overview. For priority focus area 1, value the early years, it highlights the importance of clear and consistent messaging on the importance of brain development during the early years, and actively consulting with children, families, caregivers and communities. It's critical to identify what is needed and what will work from those people and communities that the services and policies will affect. For the priority focus area 2, empowering parents, caregivers and families, it articulates the importance to equip parents, caregivers and families with accessible evidence-based information on early childhood development to support them with the skills and knowledge to help their children develop and learn. It ensures parents have local opportunities to connect with other parents in their community, and it articulates the importance of having an early years sector that is responsive, high quality, evidence-informed and accessible, specifically with early childhood supports. We've heard directly from families around the unnecessary complexities of services and accessing them. So accessible supports and services are a key priority with which the government will be looking to address. This priority focus area also includes focus on supporting access to high quality, affordable early childhood education and care, which is relevant within the Department of Education. Priority focus area 3, support and work with communities. This will have a focus on place-based approaches to supporting families and communities. It also highlights the importance of shared decision-making, for example, co-design and user-led design. And finally, strengthening accountability and coordination. We'll have a focus on improved information and data sharing, data integration and analysis across governments, service providers, communities and academia. It highlights the need for ongoing collaboration with state, territory, local governments, our philanthropic partners and communities to ensure that children and families' experiences are seamless. So this will be achieved by making sure that individual and joint roles and responsibilities of agencies are clear and transparent within the Australian government. by capturing data that reflects the views and lived experiences of children, parents, caregivers, kin and communities, and sharing community and service level data to make it easy to understand and interpret. And now I'll hand back to Jack to go through the strategy's outcomes and next steps. Thank you, Jack.
Thanks, Helen. So the outcomes under the strategy really serve to provide a measure to guide and ensure the whole of government approach, really so everybody is working towards the same goals. The outcomes will be used to measure how children are faring and how well they are growing and developing. And there's also family and community level outcomes. The strategy's 8 outcomes were based on existing wellbeing frameworks like ARACY's Nest for children and young people, but also outcomes which reflected what we heard directly through the consultation activities with children, parents and stakeholders. So, for example, outcomes 2, 3 and 4 were developed based on evidence and internationally recognised as elements that matter to young children's health, wellbeing and development. And we heard through the consultations the importance of including that focus on the child mental health even at this young age. For outcome number 5, children have opportunities to play and imagine. That was specifically developed following those insights from the children's consultation, but also what parents told us about their hopes and dreams for their children. Outcomes 6, 7 and 8 really reflect what we heard in consultations about what parents and caregivers said was important to them, as well as the evidence on how a family's wellbeing and accesses to resource really impact a child's development. It's important to say that the strategy's vision and outcomes also align to the National Agreement on Closing the Gap priority reforms, including the socioeconomic outcome areas of Target 2, children are born healthy and strong, Target 3, that children are engaged in high quality, culturally appropriate early childhood education in the early years, and Target 4, that children thrive in their early years. So over the 10-year life of the strategy, the government will develop 3 action plans and measure its impacts through an outcomes framework. So the outcomes framework will be developed throughout 2024 and will provide measurable indicators to track and progress the success of the actions taken under the strategy and to monitor the global progress against the outcomes. We are very committed to developing the framework from a data-driven perspective, but also in strong response to what people told us through consultations. We're working with data experts both in Commonwealth government and in research and non-government sector to really inform our thinking around the framework. And we need the framework to last for the 10 years of the strategy and to respond to the different elements of the strategy at different times. In terms of action plans, the 3 action plans that will come out over the 10 years of the strategy will outline practical steps of how we're implementing the strategy's priorities. The first of these action plans will be released later in 2024 and will be informed by the views, perspectives, expert advice and evidence collated during the development of the strategy. Every portfolio in the Commonwealth and at all levels will have responsibility for improving the wellbeing of children and families in Australia under the action plans. And the strategy will guide how the government will work with the states and territories and will build on the many state and territory child and wellbeing commitments that already exist. There's a lot of synergies between the Commonwealth's approach and the states. In particular, you would have seen Queensland Government's new Putting Queensland Kids First strategy has very strong alignment between their goals and our outcomes. We're working closely with our colleagues in other agencies, especially the National Indigenous Australians Agency, as well as the Department of Health, as well as the broader social services portfolio, including our disability colleagues, to develop the plans. The first action plan will build on the government's existing investment in the early years across the range of portfolios. And some of those things have already been announced by government, such as the establishment of the National Commissioner for Aboriginal and Torres Strait Islander Children and Young People to elevate the voices of First Nations children and young people, and some of the activity the government's already committed to and delivered, such as changing the eligibility for parenting payment single and the changes to paid parental leave. Some of that work and more is provided in the progress update that I mentioned earlier. That's also on the Department of Social Services website. At the launch, Minister Rishworth also announced two brand new things, which one is the $100 million Outcomes Fund, which is a partnership with under the Targeting Entrenched Disadvantage package of government. One of the three focus areas under the fund will be supporting positive outcomes for families and children to prevent cycles of intergenerational and community disadvantage. The Outcomes Fund will give flexibility to service providers to adapt and innovate their services so they're tailored to the needs of families and children in their community. And the Minister also announced the establishment of the Parent and Carer Reference Group to drive implementation of the strategy, but also to provide advice on broader government strategy over the next 10 years. So in case folks aren't familiar with the Parent and Carer Reference Group, really this is in response to the strategy's priority areas of valuing the early years and empowering parents, caregivers and families. The group will make sure the perspective of parents, carers and their children are at the heart of future policies and programs and services that are to be delivered for the benefit of families and children. It'll allow us as government to hear directly from parents and caregivers about what they and their children need and don't need, what they think works and doesn't work, and provide a valuable insight into how and when they want to access support services and programs. The group will be comprised of a diverse range of members, and it's expected to be operational later in 2024, and it will be filled through a public expression process this year. So I know that there, I can see questions in the Q&A box are going off. So I'll hand back to Liz now, and we'll answer what we can. But for those questions we don't get to today, and you'd like to follow up with us, this is our shared box. We're very happy to receive questions here for both the departments, and we'll be happy to get in touch. Thanks, Liz.
Thank you so much, Jack and Helen. It's been great to be able to hear behind the scenes, and I just love that the voices of children were reflected in the development of the strategy. So as part of the registration process, we asked people if they had any questions that they wanted to ask our panelists. We had such a great response, and we had hundreds of questions to filter through, and thankfully, you know, a lot of the hot topics were covered in your presentation, so people are getting their answers. But before we open up to the questions that are coming from the floor today, we'll start with a few of the questions that reflect the main themes that were asked on registration. So the first question that we have is, poor antenatal health and wellbeing has a major impact on not only the early years, but also later life outcomes. Will the strategy be addressing pregnancy and antenatal health?
Thanks, Liz. Yes, it does. And so if you look under the priority focus areas, we include some actions there around antenatal services. We are very interested in making sure that is captured. We agree that it can have really significant impacts across childhood. So the strategy is 0 to 5, but it does include the antenatal period. We work very closely with our colleagues at the Department of Health. They are involved in our governance groups, but also in the ownership of the actions under the strategy. I think the other thing for us to think about is the National Commissioner for Children, Anne Hollands, was very advised us not to neglect that the 0 to 5 is a moment in time, and to think about both before and after in terms of determining really strong wellbeing outcomes for children. So while the strategy focuses really narrowly into 0 to 5, we don't think that's the only time to intervene and to make things better for children and families. And we're very conscious of that. And we talk a little bit more about that in the evidence summary that accompanies the strategy.
Great, thank you. So, Helen, this is probably going to be a question more directed at you. This was also another hot topic. Was there a plan to support the skills, training and professional development of the ECEC workforce? And how will the strategy address current workforce shortages?
Thank you, Liz. So within the strategy, a collaborative focus on the early years includes a commitment to empowering and supporting those who form foundational relationships with children. This includes parents, caregivers, kin and family, but also the early years workforce, particularly within the ECEC sector, educators and teachers. So this is going to be particularly relevant within delivering priority focus area 2, which includes focus on making supports and services responsible and inclusive to children in their early years and their parents, caregivers, families, and moving towards universal access to ECEC. So in the context of the ECEC workforce, the government's taking some steps already. They're investing $72.4 million in workforce development measures, which were announced last year. This includes professional development subsidy, a paid practicum subsidy, a practicum exchange network, and we've got further information about these on the Department of Education's website. In this financial year, these programs have supported around 22,000 educators to maintain or upgrade professional development requirements through employer-provided paid leave or backfill to complete mandatory or highly recommended training. And approximately 650 studying early childhood teachers to complete practicum with wages. They were previously unpaid for these placements. These programs in this year were restricted to remote and regional areas, but from July 2024, these programs will be open to all regions, including major metropolitan areas. And additionally, paid practicum support will be increased from a maximum of 4 to a maximum of 8 weeks placement per study period. So through these programs, the government's aim is to help educators stay in the critical ECEC roles and assist them in overcoming barriers to upskilling in their ECEC career.
Thanks, Helen. That's awesome. I think that practicum payment extension from July is going to benefit so many. Okay, so one that came across was this convoluted, complex system for families, and knowing that for many families, the application process for not only services but supports and funding are complex and difficult to navigate. So people want to know, how is the strategy going to simplify these processes?
I think there's a lot of work to do, to be perfectly honest. I think that it was a very strong theme throughout consultation. And I think we know that the obligations of the burden of entry can actually be a barrier to entry, and that what we really needed to do was flip that burden of knowledge, and instead of requesting and really putting that lump onto parents, really changing the way that services operate. So a core aim of the early years strategy is try to improve that coordination of services and supports across at least Commonwealth portfolios. We're starting from principles of tell your story once, informed and with consent data sharing to lift that burden. In terms of what we'll specifically do, that'll come through action plans, but I think that it's very strongly acknowledged that from a consumer point of view, the services need to be better aligned if we're really going to enable people who need them most to get them.
Excellent. Thank you. So we've got some questions around how the strategy will support Aboriginal community controlled organisations in the delivery of ECEC within their communities.
Given it's another ECEC one, I'm happy to answer this one. So I'd say the strategy recognises and respects the role of Aboriginal and Torres Strait Islander community-controlled organisations. I'm just going to refer to them as ACOs in delivering for First Nations children, families and communities, including in ECEC. So it's much broader than, the strategy is much broader than just ECEC, but also in respect of our early learning and care sector. Cultural safety is about respecting the unique cultural identity of First Nations people. And the strategy acknowledges that supports for children and families should be culturally responsive and recognises the role that ACOs play in empowering First Nations parents, caregivers, kin and families. So they do have a special place. Implementation of the strategy is going to involve collaborating with ACOs delivering ECEC and other services for children and families, as well as First Nations partners, including the newly, well, not quite new anymore, the Early Childhood Care and Development Policy Partnership, which is a partnership between First Nations people and governments, the Commonwealth and states and territories. So for ECEC, the broad guiding principles, objectives and priority focus areas of the strategy will provide a framework for how the government considers reforms or changes within the system, including how support is provided to ACOs in the delivery of ECEC. And this is also, I'll say here, and it probably will reflect in future discussion today, it's also under active consideration by the Productivity Commission in their inquiry into ECEC. So that's a process that's happening in parallel, and government's expecting to receive the final report from the Productivity Commission in the middle of the year. So reforms within the ECEC system will be really guided by what the Productivity Commission's advice is. So it's sort of the complement for the early years strategy, providing that overarching framework, but the content within ECEC will be guided by what the Productivity Commission says, as well as advice through fora such as the Early Childhood Care and Development Policy Partnership, which is really informed from a First Nations perspective as well. I'd also just mentioned that the support for ACOs and considering how we better work with First Nations partners is not just driven by the strategy, but also other important government initiatives like the Closing the Gap Agreement as well. So that's already set out priority reform areas that the government is committed to and embedding across practice across all of our agencies.
Great. Yeah, look, aren't we all just waiting for that Productivity Commission report in the 6 days or 7 days until it's here? So we've got a question from Karen. Karen wants to know, will a public health style publicity campaign be run about the importance of the early years, something that's going to raise awareness about the value of the early years?
Oh, look, we think that would be grand. I can't suggest what may or may happen. One thing we did find, though, through some of the research that informed the strategy is the way to do that has to be really carefully calibrated, because there are sectors of the community that would find those messagings really patronising. So it's, and that was something that came through really strongly around the mental models around parenting. So if we were going to go that way, I don't think it would be a quick campaign. It would have to be a very careful campaign informed by more research and development to make sure that we got the voices right, that we were empowering people and letting them know about the influence, the positive influence parents can have within those early years without telling them what they think they already know, or potentially putting them off in terms of feeling guilt or a burden. So it's a careful line to walk, but it is something that we are considering.
Excellent. Okay, so those of you in the audience, if you didn't know, we're now on to your questions. So we've got a question from Kirsten, and Kirsten would like to know, can we please talk to the tension of how supports can both be evidence-based as well as increasing co-design and user-led design?
I feel like that's every conversation in government these days, to be perfectly honest. I think there has to be a place for both. I think that, this government in particular wants to do a lot about place-based and really that co-design or user-led design with communities. Sometimes that's just going to be based on what communities have experienced and know what works rather than having a body of academic research behind them. But we also need the academic there in the right place. So one of those areas would be around evidence-based intervention for children that are experiencing developmental delay. That's also been a focus of this government, and making investments to really build that evidence base, because in order to be safe, we also need to have that evidence driven. So it is a balance. There is a place for both. Helen, did you want to add anything?
Yeah, just echoing your points, Jack, as well. And I'd say it's not just a place for both, but having them work together as well. So bringing in the evidence into co-design discussions with communities as well, so that you're able to reflect on local needs and experiences as part of the evidence, as well as what research and studies might also inform that practice as well. So it's something the government's working towards slowly and getting better at co-design, but it's a really important feature, and it does require bringing in the voice and the evidence where you can, so that you can consider the full spectrum.
All right, so we're still on the theme of that working together, but we've got a lot of people who have asked, how will you coordinate with the states and the different local government agencies, knowing that there's such a disparity across our country in the way that ECEC and early childhood development is approached?
Do you want to take it first, Helen, and then I'll add to that?
I do. I did write down some notes for this one because I saw it in the questions coming through earlier. Sorry, there were lots of questions, so it's wonderful to see how engaged everyone has been on this topic. It's wonderful. So in terms of the strategy and how it's going to be used with the states and territories, I would say probably first up, it's a whole of Commonwealth strategy in the first instance. So it was not agreed with states and territories, but as Jack mentioned earlier, it's really in alignment with what nearly all states and territories, if not all of them, have also put forward as their key priorities in the early years as well. So there's common alignment across where government's views and visions are in the early years. So the example that Jack mentioned earlier, the Queensland government recently announced they're putting Queensland Kids First, which has similar principles and priorities to the early years strategy. So in terms of how we're partnering, I think it's using the framework of the early years strategy to be our guiding sort of light, our markers in the sand for what our principles are, what our objectives are, and working in partnership with states and territories to make sure that we're working in the same direction. And that's across all of our agencies as well. So within the Commonwealth, we've currently got the Preschool Reform Agreement, which is an agreement with states and territories. And I know there's agreements within Department of Health and Department of Social Services as well. So it's making sure that every time we're doing these collaborative projects with states and territories, we're reflecting on what we've set out at the Commonwealth level as our priorities for the strategy and making sure that reflects throughout. So that's the guiding framework. Within ECEC as well, when we're considering the Productivity Commission's recommendations, we'll be thinking about, well, what is the strategy's broader overarching framework given us for how we respond to these things in the specific sectors. Jack, did you want to add to that one?
I think the only thing I'd add is the Outcomes Fund that I mentioned is a joint activity with states and territories. So that will be one of the first kind of live projects that will be jointly and state-based around the priorities of the early years strategy. I think the only other thing I would add is that I've had a long career in ComState. Sometimes the very best way to do it is bilaterally rather than waiting for everybody to be ready to do the one specific thing that you want to do. And so that's something that we'll be starting to look at going forward.
So we've got a couple of questions that have come in specific with regards to services that are funded by DSS. So will DSS funded programs be refocused to reflect the early years strategy's priority focus areas, outcomes and data requirements?
Not midstream. We're not going to do it to you halfway through your agreement. So, for example, all the children and parenting, so the CAPS, Children and Parenting Program, support program now sits with me. We're interested in making sure we can grab from the reporting you already do around how we're benefiting the early years and what our investment is doing in that area, but we're not going to make you update your activity work plan midstream. I think going forward at the end of the current funding agreement, so that takes us into about 2026, I think, for most, it would be reasonable that in the new agreements that would become a stronger focus, but no need to revise right now.
Right. So sort of in a similar vein, instead of capturing the information from service providers that are funded are wondering, will they be able to get some insights from the parents and carers group that you're doing to be able to inform their programs?
I think so, yes. I think that would be what we would like. The Parent and Carer Reference Group will be there to really be a independent advice to government, and we might take things to them in their development stage or in their review stage, and the group may also identify the things they want to look at. So I think potentially there's opportunity there, but it is going to be a bit of a joint decision-making forum, so we probably have to wait and see how the terms of reference get settled, and then how we work with the chair about what they'd like to do in their first sitting kind of term. But in an ideal scenario, certainly what we would like is for that group to really inform principles, guidelines and processes that we could share. That I think that would be useful to service providers. But we'll see how we go once it's all set up.
Right. So we've got a question that here asking, how will the strategy be aligned with Treasury's Measuring What Matters framework?
We love measuring what matters. And that framework last year actually included a specific chapter on the early years and about social determinants of health and the way investment in the early years can really make a difference over the longer term. Our Measuring What Matters colleagues from Treasury are very closely involved in the outcomes framework development with us, and we will be very aligned in what we are doing. We also know that the Measuring What Matters identified a number of data gaps, and that's also something that we will take a look at into the future as well. So I think there's great harmony between the two pieces of work.
Wonderful. So we've got another question which asks again about specific strategies. So in particular, the Closing the Gap strategy and Australia's disability strategy. So how are they going to be included and aligned with this strategy?
Well, we're obligated to. So they're fundamental to the work that we do across government, not only in the early years strategy. So, for example, I mentioned some of the socioeconomic outcome targets under Closing the Gap. The activity under the early years strategy directly goes into the reporting under those targets for Closing the Gap. We also have some of the priority reforms under the Closing the Gap in terms of the work we do directly with Aboriginal community controlled organisations and also transforming the way government works. There are lots of opportunities to do that under the early years strategy. Helen touched on some of the ECEC work with Aboriginal community controlled organisations. The partnership is a activity under Closing the Gap, and that's about coming together with First Nations leaders in a joint decision-making forum. We also, in terms of Australia's disability strategy, we are very driven by that, particularly around the inclusion of mainstream services, because I think that's the opportunity under the early years strategy. It is a mainstream strategy in that it affects all children, but we need a basic level of service for all children and then a triaged approach for children who need specific interventions. And that's what Australia's disability strategy seeks to achieve, a broad-based, accessible community. and also a respectful community. There's a whole part of the ADS around community attitudes, around the inclusion and mainstreaming of people with disability, and that is reflected in the early years strategy as well. So I think you'll see a lot of joint actions that report against all of those strategies.
Okay, so we've got Catherine here who said, Helen, it's wonderful to hear about the financial supports for training. And she says, potential ECEC educators from regional areas find it a barrier to attend funded training. So the costs in time, travel, accommodation, particularly for those that live more than 4 hours from metro, and sessions, running 1 day a week. How can you better, or how can we better support them?
It's probably, I'll admit right up front, it's probably a little bit beyond my expertise, but I think under the strategy, those kind of things, and also probably considered under the response to the Productivity Commission inquiry, is making sure that we're doing what we can to leverage technology and new ways of doing things to make these things more accessible to people. For ECEC, we know that access to services in regional remote communities has been a real challenge, and that includes for educators and teachers working in regional communities as well. So I think looking at those issues to ensure that families can access the supports they need requires a consideration of how people working in the communities and working in ECEC services can access that quality training that they need as well, so that the quality doesn't become well, if you can access it, you can deliver it. It needs to be available to everybody, no matter where you live. And I think that's a key priority under the strategy and within the ECEC system as well, ensuring quality for children's outcomes.
All right, well, a notice has just popped up that we've got 5 minutes remaining of this meeting, and I'm just like, where has the time gone? And we have so many questions, and we really thank you for your time. So I'm going to end on this question here that Kirsten has asked. You've mentioned the need for data sharing and data integration. Can you detail how the federal government is going to support the access to and sharing of data?
So there's a number of initiatives that are seeking to make that more public around that data. So there's the Life Course Data Initiative funded under the Targeting Entrenched Disadvantage. So that's a collaboration between the ABS and other Commonwealth agencies to provide sorry, I'm just going to make sure I get my words right. Making sure we understand the interventions across a child's life and across a whole life, and how that leads to positive or otherwise outcomes. There's also, and the supports that people receive at different ages and stages. There's also other data projects that are under development across the Commonwealth, like the Child Wellbeing Asset. These joint assets with states and territories do take quite a long time. The first one off the rank will be the National Disability Data Asset, which will give us integrated data with states and territories for the very first time around some of those elements around disability. So it's certainly where we want to go, and the government's already very interested in investing in these things. We, of course, need states and territories to agree, and then we need to provide a way for services and parents to see the data in their own local community. One of the things the government has recently released is the Digital Atlas, which provides kind of geospatial data for the government services in a particular area. They're government run rather than government funded, but it gives you an idea of the future in terms of how place-based data accessibility, where we're going with that. And so I do encourage you to, if you are into the data, have a play with Digital Atlas. It's quite fun, and it's where we will be building and going into the future.
Brilliant. Thank you so much, Jack and Helen, for your time today. And thanks for answering some of the questions that we were able to get through. Hopefully we can have you back at another stage. Perhaps after action plans are developed, you can come back and share more with our audience. So whilst that brings us to the end of today's webinar, the recording of the session will be available in the coming weeks on the ARACY website and YouTube channel, and the links will be shared in the ARACY newsletter. If you aren't already, subscribe to our newsletter to be kept up to date with news, events and future webinars. The link's in the chat box now. So ARACY hosts webinars to share information and promote discussion across a range of topics. We welcome the opportunity to elevate evidence and centre the voices of those with a lived experience. Through these webinars, we seek to grow professional capability and knowledge across the sector. So if you're joining us today and your organisation would like to partner with ARACY on future webinars or other initiatives, please reach out to us via the email address inquiries@aracy.org.au. which will also pop into the chat box as well. So now we're bringing this event to a close, but thanks so much for joining us today. We've got lots of messages of thanks and support coming through in the chat from all our participants. So thank you, Helen and Jack, once again, and we hope to see you back here soon.